Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to giving you not only effective, but safe, healthy, natural ways of overcoming diseases and conditions that you wouldn't believe are possible. And today we're talking about another one, a life-taking disease or condition called amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, because Lou Gehrig, the Yankee baseball player that got it back then, wound up dying from it. And yes, it's a life-taking disease, as you know, if you have it and you're listening to this show. It's a progressive neurologic disease that affects the nerve cells, your motor neurons in your brain and spinal cord. These neurons, these nerves, control all voluntary muscle movements like walking, talking, chewing, and breathing and swallowing. All right. You may first notice that you're having problems from this when it first began, but I'm going to get into all this. You know what? Let me wait. Let me first thank my sponsors. It's very important that I do because they help pay for me being on and you getting it for free. So you don't have to, you should subscribe. I wish you would. They asked me to tell you that to our channel. That would be very, very nice. That helps us. So subscribing to the channel is something I ask you to do. But on the other hand, you don't have to pay for it because my sponsors do. So the first is Promolife, and that's very important. You should get a pen and paper. And you could reach them at 888 742 3404. That's 888 742 3404. And you should call them and tell them you heard about it here on the show because you're going to want to be doing for this problem what they will be discussing and what they offer. Home care ozone therapy. You tell them you want to get set up for home care ozone therapy. You heard about it on the show. They'll give you a discount or something special, depending on what you're purchasing. And you're going to learn about what to purchase if you listen to the show, the rest of the show. I also want to thank Doctors Biome. Very important here. Doctorsbiome.com. DoctorsBiome.com. Doctor's Biome is a very special probiotic beverage. You may be taking probiotics, you're wasting your money, you'll learn why. But it's very important because the gut communicates with the entire nervous system. It communicates with the brain. It's called the gut-brain axis, the gut nervous system axis. The gut bacteria communicate with everything. You can't have a healthy body without a healthy gut. It's that simple. And they're very delicious probiotic beverage because all the living bacteria are living in a 100% organic mint, kale, lettuce, celery, cucumber, apple, lemon juice. So it's delicious, 100% organic, comes with a 100% money back guarantee, free shipping. But if you want to save some money, use my patient coupon code, Howard35. And you can give that to anybody you like. And this way you'll get 10% off the retail price. And if you want to save more, trust me on this, it's that important. Go on subscribe and save. I call it auto ship. Subscribe and save. Now you'll get an additional 10% off. So a total of 20% off the retail price. It's worth more than every penny in this situation. So make sure you order Doctor's Biome. And if you happen to be on a feeding tube because of this, you'll be able to use it through that as well. In any case, let's get right into the show. It's a pretty serious disease. It kills people every day. People are dying from it. It starts out, you may have some trouble walking, you may trip and fall a little bit. Well, you don't think much of it unless you're very young, because you can get this at almost any age. Usually it's an adult. You don't see it in children. You get weakness in your legs and your feet, your ankle. Your hands may become weak or clumsy. You may start slurring your speech. You have trouble swallowing. You may start getting twitching. People see yawn. They laugh, they cry, they may yawn at times where it just doesn't seem to be normal to do that. Your thinking may come off, though your mind doesn't go with this, generally speaking, but you start to see behavioral changes. And it's the feet and legs that seem to go first in most people. Well, in any case, eventually you become bedridden. Now, there's two ways you can become bedridden. One, you can go into spastic paralysis. I've seen cases of that where they're in total spastic paralysis. And now you become emaciated because when you're in spastic paralysis, your nerves are firing, your muscle nerves are firing constantly and burning up energy big time. Eventually, you have trouble swallowing to the point where they have to aspirate your saliva, otherwise, you could choke to death just on saliva. I know it sounds terrible, but I want you to understand. I understand what you're going through if you're listening to this show, or what you're going to go through if you don't do what I'm going to be suggesting. It's not a choice. This is what happens. Eventually, you can't chew your food and swallow, so you wind up with a feeding tube going in. So you're fed that way. And then eventually you have to go on a respirator because you don't breathe. You have no control over breathing anymore. So that's where Lou Gehrig went into the iron lung. If you ever watched that movie on his life from way back when, it's a pretty amazing movie. And he's in the what they call the iron lung back then that would breathe for you until eventually he passed away. Gary Cooper played him in the movie. Wonderful, heartbreaking movie. And today we could have fixed him. We could have saved his life. By the way, no moral and ethical doctor should ever promise and guarantee a result. I don't care if you're successful 10,000 cases in a row. You never know what's going to happen on the next one for some reason. But even when people believed it's too late with this problem, I've seen where they've turned around completely, come out of spastic paralysis and into relaxed, call it flaccid paralysis, and then eventually start to get use of this back again. What causes this? Nobody knows. The claim is that some of it may be inherited. They claim 5 to 10%. I have an opinion about that I'm going to give you. It seems to be random. Every single person that I know that has this diagnosis has had chickenpox, the herpes zoster virus. And I believe that it's the herpes zoster virus which lays after you get chickenpox in the dorsal root ganglia of your spine dormant. When it flares up and moves up your spine, it causes amyotrophic lateral sclerosis and eventually reaches the brain. And this is why I believe it kills people, because they don't know that's what it is. And in traditional medicine, they don't have a way to fix a virus. Thank God we do. Thank God we do. So, yes, I could be wrong one day when maybe they'll give me a Nobel Prize nomination for coming up with the answer to ALS. It's pretty serious. I don't know if it deserves a Nobel Prize, but if what I'm going to tell you saves your life, I bet you do. So, intravenous ozone therapy, the answer for it, and the direct IV method only has been the answer for it. Now, I can't say that all versions of direct IV where we push the oxygen and ozone gas directly into your veins. Now, I've been doing this for the direct IV method as of the date of this show for over 30 years of my 35 plus years doing intravenous ozone therapy. We've done over 385,000 treatments, proving not only its benefits and its safety. So if you're going to start reading about it on the internet, oh, you can't push oxygen and ozone gas safely directly into veins, it's ridiculous. It's absolute ridiculous, because I've proven you can, not only effectively, but safely. Here in New York State, they don't care if it kills you with a pharmaceutical, but if it hurts any one person with ozone therapy, they'll put me out of business instantly. More importantly, I won't go to sleep at night. I'll have permanent insomnia. It's the kind of doctor that I am. I take Dr. Do No Harm very seriously. So let's be very clear. I don't care what you read on the internet. I don't care what any other doctor or any AI tells you. It's when done correctly by licensed, trained medical professionals. Okay, Robbins' method of direct IV, I believe you can get over this serious life-taking disease. Again, no promises and guarantees, but I've seen nothing but success. Unfortunately, there is no average, typical, or usual number of treatments that it may take to get you over this infection because intravenous ozone is not a guided missile. I can't whisper in its ear, hey, go after this, leave everything else alone. Because when the medication, and it's medicine, ozone is just medicine, enters your blood, it destroys every virus, fungus, yeast, mold, bacteria, parasite, toxin, harmful free radical, and it also removes toxic metals off nerve tissue. Now, this may be why I'm so successful. Maybe there's toxic metals that's the cause of this problem attached to your nerve tissue. And regular chelation therapy, which I'm going to do a show on shortly, while it can clean out your blood cells, it cannot take it off nerve tissue. And I've proven that Robbins' method of direct IV ozone can take it off the nerve tissue. And this may be why we're so successful in fixing this problem as well. Again, academically, I always like to know what I treat because I train doctors from around the world and I lecture around the world at medical meetings and at people meetings sometimes. Fact of the matter is, clinically, I'm a frontline clinical doctor and I only care about one thing: get you well. You and I only care about one thing: get you well. So technically, we don't know what we're fixing. As long as we fix it, that's all that matters. When a person has ALS, I've learned treating it every day, 5 or 6 days a week, becomes essential in getting rid of this problem. We don't treat it at the minimum of 3 treatments a week. Now we have to hit it hard. 5 or 6 doses of medicine a week, and more than one a day is even better. I developed Robbins Fast Track where you can do up to 3 treatments per day, depending on we offer it. Definitely in our Manhattan office, you can get it twice a day, 6 days a week. So that's a dozen treatments in 1 week. Now you're going to see some real rapid benefits. And again, everybody wants instant. This is not instant. Ozone therapy is S&S, safe but slow. Pharmaceutical medicine, which they don't have an answer for this problem anyway, would be fast and dangerous. So all they can do is treat symptoms to some degree. We're getting to the root cause. Again, I don't know what the root cause is. I wish I did. So when I discuss this and train doctors, we can be certain. Is it the herpes zoster virus? Is it toxic metals attached to the nerve or whatever? It's certainly not genetic because ozone doesn't fix genetic diseases. And I've had nothing but success in fixing this one. Okay? As you're going to learn if you listen to my show, Intravenous Ozone Therapy, everything you need to know when you listen to the direct IV section of that podcast, it explains how we slowly inject using little itty bitty baby needles so we can get little itty bitty baby vein in your, thus we're able to treat virtually 10 out of 10. For those of people that have their veins completely shot, we also can get a PICC line put in, PICC line, a PICC line. It's like a tube that they insert through a deep vein. It goes down in your vein all the way over to your heart. And the problem of not having anything but little itty bitty or no veins at all to use anymore, because this is your body so severely, you haven't eaten, maybe you've lost tremendous weight, maybe therefore you have very small blood volume, trouble drinking, you're in a dehydrated state. These are things that we turn around and overcome with the therapy itself. So that's essential. We need to replenish and make a healthy gut. That's where the doctor's biome comes in that I told you to go to doctorsbiome.com. You need to order it. Stop with all these other probiotics. They're, in my opinion, absolutely worthless. If you listen to some of my shows that I've done on microbiome, on probiotics, you'll understand why. I won't waste our time here. This is part of my protocol, Doctor's Biome probiotics taken every day. Now, you can go to Promolife and get set up for home care. Home care ozone in this situation is rectal insufflation, an ozone enema. It's easy to have someone do for you if you're not capable of doing it yourself. You can do it twice a day. I don't believe that rectal insufflation and Doctor's Biome is going to fix your problem. You need direct intravenous ozone therapy because I believe this is a virus. I'm not in favor of the blood methods of ozone therapy for this problem. I believe the direct IV method is the one that you use. My version of it, RMDIV, Robbins method. It takes 2 to 6 minutes to complete the treatment. It's been proven safe and effective with this problem. And within very short periods of time, within weeks to a month or so, we can get complete turnarounds or significant turnarounds in the symptoms that you're suffering from. You may have questions. Call my office in Manhattan at 212-581-0101. That's 212-581-0101. Tell them you want to speak with me. They'll tell you how to contact me, and then we can talk. I can answer some questions. But hopefully you've listened to this podcast first. In addition, remember to go to Promo at promolife.com and Doctor's Biome, DoctorsBiome.com. Order their products. You can certainly start using that even long before you get to me. This is a serious problem. If you're listening to this show, my heart goes out to you. I hope that you're able to come in and get the care from me or get a doctor who can come and get trained by me so that they can do it in your neck of the woods. Everybody, thank you for listening. Please subscribe to our channel. That's very important and helpful, and I appreciate it. Listen to all our podcasts, or actually view all our podcasts. You may know somebody else that'll benefit from one of them. Thank you so much. Stay safe, stay healthy, and well. Bye-bye now.